want to be able to provide a video demonstration of how to don and doff appropriate personal protective equipment, including droplet and contact precautions, and then also walk through how to don a beard cover, and then subsequently how to doff it both in the extended use environment and the reuse environment. As you can see, Dr. Strand has cleaned her hands and she is putting the gown on, which is the first step within this procedure. One of the real key things on this is also, once the mask is on, to avoid direct hand contact with the mask, both in the donning and doffing of the front of the mask. That's easily the #1 area of vulnerability for us as healthcare providers, is touching the front of the mask in the doffing process after patient contact. So after washing our hands and donning the gown, Dr. Strand is putting on a simple surgical mask. The next step, as far as that Dr. Strand will move forward, is actually applying the beard cover. And this is an added thing with COVID that we haven't seen as much in other times, so this is really important. And what this allows us to do in the extended use and reuse environments is ideally prolong the life of the mask that we're wearing, whether they are simple surgical masks or an N95. Now Dr. Strand is taking out her own personal pair of protective eyewear. And we'll show at the end of this also that how to exit the room with being able to clean those. And this is a critical piece. So she has now washing her hands again, or cleaning her hands again with hand sanitizer prior to putting on her gloves, and allowing adequate time as far as for not only drying of that sanitizer, but preparing to get her gloves in place. Again, I can't underscore, as far as for the beard cover, really lengthens the reuse and extended use life cycle of our masks. Extended use would be an environment where we're cohorting, similar to the emergency department or a PUI unit within Cardinal Glennon. All right, so she has appropriately donned her equipment. She is going into the room to provide patient care. And she's doing that, and then we'll be exiting the room. So the first step, as far as for doffing equipment, is a fluid removal of both gloves and gown all at once, and kind of that sweeping fluid removal and taking it right to the trash can, and she's doing a nice job as far as for that. She again is cleaning her hands between that process, and now what she will be doing will be doffing her beard cover. She appropriately actually doffed her eyewear first. Note how she's putting the Sani wipe over the eyewear, and she'll be using that after she exits the room to clean it. Now she's doffing her beard cover. With the beard cover doffed, now if in an extended use environment, she could exit the room and leave that mask on if we were in a cohorted unit, again like the emergency department or a PUI unit. In this example, however, she's exiting the unit, the door. Piece of important clarification for the reuse policy. When doffing a face mask and subsequently putting it in your individualized brown paper bag so that we can reuse it, face mask should be carefully folded so that the outer surface is held inward and against itself to reduce contact with the outer surface, or I should say the inner surface of the bag during storage. This is really key. So again, doffing the face mask, not directly contacting the outer surface of the mask, doffing it using the ear loops, folding it in on itself such that the outer surface of the mask is not contacting the inner surface of the bag. Then the folded mask can be stored between uses in a clean bag and can be reused because we have not either contaminated the bag or the surface of the mask. It's also important to remember that during reuse or extended use, that it is appropriate at those times to change out masks when they are damp or soiled. So the idea with extended use, again, in a cohorted unit, similar to either the emergency department or a PUI unit, would that mean you can have extended use of the same mask? But if indeed, or when, that mask gets damp or soiled, then you would need to change out those masks. Same thing as far as for reuse. The recommendation is to reuse up to 5 times, but if prior to that the mask becomes damp or soiled, we would need to change out masks during that time. All right, well, thank you, Cardinal Glennon, for the attention as far as for this video. Thanks to Dr. Strand, and please keep the questions coming in about how to appropriately use PPE during COVID. Thank you.